If you're struggling with SI joint pain, buttock pain, or even leg pain, I've got something that can help you feel better, sometimes within minutes. Hi, I'm Dr. Peter Turner, a dedicated chiropractor at World Class Chiropractic here in Ellicott City, Maryland. I've helped countless patients relieve SI joint pain using our special 4-stretch sequence crafted throughout the years of experience to deliver relief fast. Now, what makes this unique? This sequence is designed to progressively balance your pelvis, target the right muscles in the right order, and safely relieve stress on your SI joint, all without drugs or risky treatments. In this video, I'll guide you step by step so you can do these stretches easily at home, no matter how severe the pain is. And stay tuned until the end for my bonus mobility exercise that will leave your pelvis and spine feeling better than ever. Let's get started. The first stretch in this specific sequence is the hip flexor stretch. The hip flexors are often tight due to prolonged sitting, whether driving a lot in school or at work, and can lead to a pelvic tilt, which can strain the SI joint. Starting with this stretch relaxes the pelvis and creates stable foundation for the further stretches. The key benefit to the hip flexor stretch is that it reduces the tension around the front of the pelvis, allowing the SI joint to rest in a more neutral position. So what we want to do for this stretch is the first thing is we're going to put our one leg forward, foot flat on the ground, and we're going to rest the back knee on the ground, keeping our torso upright. What we want to do is we're going to lean forward into that stretch. Now what we want to do is we want to take deep breaths. I like to go on a 5 to 7 count breath per stretch. What we do is as we take a deep breath in and we let it all out, what that does is that causes those muscles to relax and you're able to get a deeper stretch. We're going to do that for 5 to 7 breaths. Now after those breaths, what we want to do is we want to switch and make sure we're doing it both equally on both sides. The second stretch is the knee to chest stretch. Tight hamstrings and glutes can pull that pelvis backwards, indirectly stressing the SI joint, and after releasing the hip flexors, addressing that posterior muscle group ensures balance between the front and the back of the pelvis. The benefit of stretching this area is it alleviates the tension that contributes to misalignment and stabilizes the pelvis. Now the way that we do this stretch is what we want to do is we want to lie on our back with both legs extended. What we're going to do is we're going to bring one knee towards your chest, holding it with both hands. And while you take deep breaths, we want to bring that knee towards your chest. Just like we did with the hip flexor stretch, we want to make sure that we're taking deep breaths, letting it go, and feeling that stretch deeper with each breath. And again, we're going to switch and do both legs. The third stretch we're going to do is the piriformis stretch. The piriformis muscle is located near the SI joint, and it can contribute to sciatic nerve pain and SI joint discomfort whenever it's tight. Once the pelvis is more balanced from the first two stretches, this stretch can effectively target deeper hip muscles. Now stretching the piriformis can relieve the pressure on the sciatic nerve, reduce hip tension, impacting the SI joint. Now to do this stretch, what we're going to do is we're going to lie on our back with both knees bent. We're going to take it and cross one ankle over the opposite knee, creating a figure 4. And what we're going to do is reach through our leg and grab the bottom thigh. And what we want to do is we want to bring that thigh towards our stomach. Like before, we're going to do this for 5 to 7 breaths. And then we're going to switch sides. Now, if that position is difficult, what I want you to do instead is we can take the opposite leg. We're going to reach it over top of our plant leg on the ground, putting our foot on the outside of the knee. And what we're going to do is we are going to hug our knee to our chest, just like this. Again, focusing on 5 to 7 breaths per side. The fourth and last stretch in this sequence is the child's pose. Now, performing the child's pose stretch last ensures the other pelvic structures are already relaxed, allows for a deeper, more effective release. This stretch also allows for slight decompression of that lower spine. For the child's pose, what we're going to do is we're going to kneel on the floor with our toes together and our knees apart. What we want to do is sit back on our heels. We're going to extend those arms forward. And we're going to reach out and bring our chest as close as we can down towards the floor. Just like before, again, we're going to do 5 to 7 breaths per each hold. Now for your bonus exercise, the cat-camel mobility exercise. The cat-camel is a gentle spinal mobility exercise that involves alternating between arching and rounding the back in a slow and controlled manner. We perform this last because it works to integrate the benefits of all the previous stretches we did while gently mobilizing the spine and the pelvis. The benefit of the cat and camel exercise is that it improves the flexibility and mobility of the spine and the pelvis while promoting relaxation and gentle movement of the SI joint area without adding stress. It provides a soothing final reset to conclude the sequence. So in order to do this, what we're going to do is we are going to have our knees underneath our hips at hip width. We're going to reach out forward to where our arms and hands are just underneath our shoulders. And as we take a deep breath in, we're going to arch our back. And then as we let it go, we're going to work on bringing into this position. With every breath, we're able to work on a slow and controlled spinal mobility exercise. This exercise specifically, what you want to do is you want to aim for 5 to 10 revolutions per motion in that segment. And as you continue to progress, you can work up to 30 times per day. Now, what I want you to do is as you go through these 4 stress sequences as well as the mobility exercise, start slow. Do 1 set a day, whether in the night or in the afternoon. And eventually what I'd like you to do is work up to 3 times per each one. 1 in the morning, 1 midday, 1 afternoon. You want to go to tolerance. You never want to be in pain while doing these exercises. But as you progress, it gets easier on the body and you're able to move through these motions a lot easier. With the 4-part stretching sequence and the bonus cat-camel mobility exercise, you now have a comprehensive routine for SI joint pain relief and improved. Be sure to come back to this video every day and follow along for consistent SI joint pain relief and improved mobility. And if you got relief from your SI joint pain, please like and share this video so others can benefit too. I'm curious, which exercise is your favorite? Is it the piriformis stretch? The hip flexor stretch? Leave a comment below and let me know. Also, go ahead and subscribe right now if you want to learn more ways to enjoy life free from pain, filled with health and joy. The next video that you should watch is this one. If you want to learn how to get SI joint relief when you sleep, sit, and stand, go watch this video next.